Hello everyone, I'm Dr. Swati Dubey and today we'll be talking about levels of prevention and vitamin and its deficiency. They are topics of community medicine. Vitamin can come under biochemistry too. Okay, so first we start with levels of prevention without wasting any time. What are the primordial level of prevention, primary, secondary, and tertiary level of prevention? Okay, so what are the risk factors? Okay, then what is the disease or complication is avoided or death is avoided? What all we can avoid? Okay, and what all are present? We'll deal with that in this chapter. So firstly we will start with the primordial. Okay, when you first I'll tell you how to remember. Okay, just remember, put cross for all. Okay, then one tick, then two tick, then three tick. Okay, and cross for the remaining. This is your way to remember this table. Just rectify this table. Okay, now I will explain you primordial level of prevention. Okay, primordial level of prevention is like lifestyle modification. You don't have any risk factors. Okay, you just have to follow your lifestyle and keep modifying it. If you think like you are obese, just modify your lifestyle. Okay, lifestyle modification is an example of primordial level of prevention. Primary level of prevention, primary level of prevention is you have a risk factor. Okay, you can get some disease. Okay, so you will take a prophylaxis or vaccine. Okay, so that is the level of prevention. You will have to prevent the disease, but the risk factor can't be prevented. Okay, the risk factor will be present and you will have to prevent the disease from happening. Okay, so it will involve your specific protection, like from vaccinations, chemoprophylaxis, vaccines, chemoprophylaxis. Okay, so in primordial you just have to see lifestyle modification. There will be no risk factor, no disease, no complication, and death is not to be talked about also in this. Okay, primary is there will be specific protection. You will have to take protection because the risk factor is present in the environment. Okay, so it will be your vaccines and chemoprophylaxis. Okay, you have not got the disease, but the risk factor is present, so you might get it, so you will have to take the prophylaxis. Okay, or the vaccine. The secondary level of prevention includes your early diagnosis and treatment. Okay, you know that the disease is present. Okay, but if you do an early diagnosis or treatment, then you can prevent the complications. Okay, the risk factors will be present. Okay, the disease is also present, but if you identify a cancer 1 to 2 year prior to the time of its identification, then you can prevent the complication a little bit. You can delay the complication. Okay, or any other disease, be it be, if you can find the cause of the disease or you can find the disease, then you can prevent the complications. Okay, the early the diagnosis is done, the early the treatment can be done and the complication can be prevented. Okay, and then it involves the tertiary level of prevention. Tertiary level of prevention is that it be delayed it. Okay, and somehow the patient got the complication, so we will have to avoid the death. Now, like your patient has acute liver failure. Okay, so liver failure is done, that is the complication. Okay, but to avoid the death, what will we do? We will do transplant. Okay, or rehabilitation. So this is to prevent the death. So this is tertiary level of prevention. So there are four levels of prevention. The first level of prevention includes the primordial, the primary, the secondary, and the tertiary. The primordial will include your the primordial will include lifestyle modification, and you will have to prevent the risk factors and everything. If the risk factor is present but the disease is not present, then it is which level of prevention? It is primary level of prevention. If there is complication but death can be prevented, which level? Third, tertiary level of prevention. Okay, this is a very important 4 by 5 star topic. Okay, and it is very important for the exams. Please study this for your FMG and ICET, whatever exam you are giving, and then this would be very helpful to you for the further exams. Okay, so this is our levels of prevention. This is our levels of prevention. Okay. Now we'll go on to our next topic, which is vitamins. For vitamins, the names you need to know of the vitamins. So, for the names of the vitamin, we have made a mnemonic: Reti, Rini, Pappy, bring food, can, and chocolate to people. Okay, all the capital letters will be your mnemonic letters. Okay, like R, E, Ray. So, retinol, vitamin A, the name of vitamin A is retinol. Okay, TI, vitamin D is thiamine. B1 is vitamin B1 is thiamine. Vitamin B2 is RI. Okay, RI. Oh, I'll write it. Okay, Rini, Pap, P. Okay, so RI, riboflavin, riboflavin, riboflavin. Vitamin B3 is niacin. Vitamin B5 is pantothenic acid. Pantothenic acid. Vitamin B6 is pyridoxine. Pyridoxine. Okay. Now I have BFCA. BFCA. Okay. Bring food, can, and chocolate for two people. Okay. So B, vitamin B7 is your biotin. Vitamin B9 is your folic acid. Vitamin B12 is your cyanocobalamin. Vitamin C is ascorbic acid. Vitamin D is cholecalciferol. You all know vitamin D, how important it is. Vitamin E is tocopherol. And vitamin K is phylloquinone. Okay, so remember the names of all the vitamins. Okay, it is very important. Vitamin A is retinol, vitamin B is thiamine, vitamin C is riboflavin, vitamin A is retinol, vitamin B1 is thiamine, vitamin B2 is riboflavin, vitamin B3 is niacin, B5 pantothenic acid, B5 5 is pentapantothenic acid. Okay, B6 pyridoxine, this is a very important vitamin. Okay, and B7 biotin, B9 folic acid, B12 cyanocobalamin, vitamin C will be ascorbic acid. Okay, D will be cholecalciferol, and E will be tocopherol, and K will be phylloquinone. Okay, these are the vitamins. Okay, we need to know in detail about like what are the diseases it can cause due to the deficiency. Okay, vitamin A, retinol, if it is deficient, it will cause night blindness. You all might be knowing about it. Night blindness is due to deficiency of, we say no, eat carrot, vitamin, it has vitamin A, and so you will not get power in your eyes. At home they talk like this, right? So you have to remember that vitamin A deficiency can cause night blindness or xerophthalmia. Vitamin B1 thiamine deficiency can cause beriberi. Okay, and en vernix encephalopathy. Okay, vitamin B1 deficiency, thiamine deficiency can cause beriberi and vitamin vernix encephalopathy. Vitamin B2 deficiency can, it is riboflavin, so deficiency will be a riboflavinosis. Okay, it's the easiest, so it's not coming in exam. Vitamin B3 is deficient, and the disease it causes due to this is pellagra. You might have studied the 4 Ds of pellagra, right? 4D dermatitis, which is Castle's necklace. Okay, on sun exposed area, diarrhea, dementia, death, pellagra, 4 Ds. Okay, you need to remember, important. Okay, now, vitamin B5. B5 is pantothenic acid. What does it cause? It causes burning foot syndrome. Okay, there will be burning sensations in your foot. Burning foot syndrome is with pantothenic acid. Vitamin B6 is pyridoxine, and what will it cause? It will cause peripheral neuropathy. Peripheral, there will be pains in different parts of the body. Okay, peripheral parts of the body, peripheral neuropathy. Now, vitamin B7, biotin. Biotin will cause dermatitis. Okay, if you don't have enough vitamin, it will cause skin infection. Vitamin B9, folic acid If folic acid is deficient, it is going to cause megaloblastic megaloblastic anemia. And if cyanocobalamin is deficient, it is going to cause pernicious anemia. And this is no question, okay? You all know vitamin C deficiency causes tell scurvy. Very good, scurvy. Vitamin D deficiency causes rickets. Vitamin E deficiency will again cause dermatitis. Okay, we tell no use vitamin E capsules, okay, for hair and skin fall. So infection, just remember dermatitis. Okay, it can also cause infertility. Okay, and vitamin K deficiency can cause hemorrhagic disorders of newborn. Hemorrhagic disorders of newborn or bleeding disorders. Okay, hemorrhagic disorders of newborn or bleeding disorders. So this is again we'll review the vitamins and the names. Okay, so vitamin A is retinol. Vitamin B1 thiamine deficiency causes beriberi or Wernicke's encephalopathy. Vitamin B2 deficiency causes riboflavinosis. Vitamin B3 is niacin and the deficiency causes pellagra. What are the four Ds? Four Ds are dermatitis, which is Castle's necklace on the exposed part of the body, okay, skin, and pantothenic acid, burning foot syndrome, pyridoxine, peripheral neuropathy. Vitamin B7 deficiency causes dermatitis. B9 and B12 both are anemia. B9 is megaloblastic anemia. B12 is pernicious anemia. Vitamin C causes scurvy, D rickets, E dermatitis and infertility. Vitamin K deficiency will cause bleeding disorders. Now, like I told you here in vitamin A deficiency, that there will be night blindness or xerophthalmia. So we need to know few points about xerophthalmia, which can come to you as a very important question in the exam. Okay, so N is night blindness. Okay, N is night blindness. Okay, vitamin A deficiency, the first symptom which you see is night blindness, but this is not specific to vitamin A deficiency. Okay, if I have night blindness, I can't say I have vitamin A deficiency, it could be something else also. Then X1A is conjunctival xerosis. Okay, there will be scarring, conjunctival xerosis. There will be scarring of the conjunctiva. This is the first clinical sign. The first clinical sign. The first clinical sign. Okay, this is a question. The first clinical sign of xerophthalmia is conjunctival xerosis. Okay. Then we have X1B in xerophthalmia due to the vitamin A deficiency. This is Bitot spot. This is Bitot spots. Okay, Bitot spots. There will be white color, wing like whitish scarring. Okay, you can see the image in Google. Okay, vitamin A deficiency for stage X1B will be Bitot spots. Okay, this is most important epidemiological marker. If there is Bitot spot, that means if there are many people of Bitot spots, okay, many patient presenting with that, then you can tell vitamin A deficiency is there in this place, or like that epidemiological marker. Okay, then you have X2. X2 is corneal xerosis. The conjunctival xerosis is now increasing to corneal xerosis. Then you have the xerosis is not is enough. Now it will cause ulcer. Okay, and then it will cause keratomalacia. Okay, and these are irreversible. Okay, these are irreversible. Keratomalacia. What is keratomalacia? It is liquefaction of the cornea. It is there. The eyes are completely gone. Okay, liquefaction of the cornea. These are irreversible damages to the eye. So xerophthalmia is very important topic. Okay. Xerophthalmia is very important topic. Night blindness is the first symptom. The first clinical sign is conjunctival xerosis. The most important they can ask you in question is they'll give you an image and they'll ask you it is a stage of xerophthalmia. Which stage it is? X1B. Okay, bite hot spots. B for bite hot spots. Okay, and 1 see B1. Okay, 1B. 2 is corneal xerosis, 3A is corneal ulcer, 3B is keratomalacia. It is irreversible, 3A and 3B, okay? These are still reversible, all of them, but corneal ulcer or keratomalacia liquefaction, you can't reverse it. Now, so vitamin A deficiency is very important. So, for vitamin A deficiency, if you have to remove that deficiency, so we need to give prophylaxis. Which level of prevention is prophylaxis? Primary level of prevention, okay? If you don't remember, just go to the table and check for this. Primary will be your vaccines, okay, or prophylaxis. So I'm going to give vaccines for vitamin A now. National Vitamin A Deficiency Prophylaxis Program, okay? We give it for under 5 years of age, okay? Under 5-year age children, okay? 0 to 6 months, 6 months to 1 year, 1 to 5 year, okay, more than 1 to 5 year. If 0 to 6 months, we'll give only one dose, only one dose. That too when vitamin A deficiency is known, okay, or documented, okay, when vitamin A deficiency is known or documented. Only in case of documented vitamin A deficiency. That too how much? At 50,000 international unit. Okay, this is 0 to 6 months. But if it is 6 months to 1 year, then you can give 1 lakh international unit at 9 months. 1 lakh international unit at 9 months. 1 lakh international unit at 9 months. Okay. And then if it is more than 1 year to 5 year, you will give 2 lakh international unit every 6 months. Every 6 months. 2 lakh international unit every 6 months. Okay. One vitamin A 1 ml solution is 1 lakh unit. Okay. 1 ml solution is 1 lakh unit. So how many mls you will give? 2 ml you will give. Okay, so if it is under 5 years age children, then you will give only one dose if there is a documented vitamin A deficiency. Okay, if there is no documentation, don't give. 6 months to 1 year, you will give 1 lakh international unit at 9 months. Okay, and for more than 1 year to 5 years, it is only for under 5-year age children to 2 lakh international unit every 6 months. Okay, and 1 ml solution has 1 lakh international unit. So now we know this very important topics which we can revise as early as possible for us, and we might get one question in the exam from this topic. So do revise it and go for your exams. All the best. Thank you.